Hey, so thank you everyone for coming. I'm sure there'll be a few more coming in as we keep going, and I'll also be recording this for anyone who's missed it. But this is a real informal event. It's not really even an event. It's just a bit of a guideline of different ways to study that you can incorporate into your own regimes. There's no like one solution that's best for everyone. These are just a little tasting platter of the different ways you can um, study for your final exams. We'll be going through Kevin, who's going to talk about mechanisms and group learning, Daniel with his Anki and flashcards, Tiffany with repeated learning, and me with cramming right at the end. So without further ado, Kevin, if you'd like to share your screen and or like open up your camera. There you go. Take it away. I think you're on mute.
Thanks, guys. Yeah, thanks, Shaf. So thanks for coming. So my little my little presentation is on mechanisms and condensed notes, which I've personally found useful, and hopefully you will too. But as Shaf said, it's really sort of up to you as to what study style you pick in the end. You sort of just trial and all these different things and just choose what's right for you at the end of the day. All right. So with mechanisms, the importance of it, first of all, is that it allows you to relate concepts in a cause and effect manner. And this is particularly useful for pathophysiology, where, there is that very strong cause to effect mechanism. These mechanisms can be used for lectures and PBLs. So for some of those fundamental physiology concepts and also the pathophysiology concepts that you encounter in PBL as well. And one very useful way to incorporate this in PBLs is to link all of the factors of a patient's history to their symptoms. So, for example, with like bowel cancer, increased red meat consumption is a risk factor for the adenoma carcinoma sequence that you'd see in bowel cancer, right? So always note these little bits and pieces of their history to what they actually experience. Now, I find it a lot easier to study concepts over a small number of pages than over many, many pages, right? You can make notes over hundreds of pages in first and second year, but it's just often, for me personally, quite difficult to digest. If I have like, say, 20 versus 50, 500 pages, that's a lot more processable, I guess. Now, mechanisms can also be considered as a semi-visual way of learning. And what I mean by that is that you can remember what info is in what part of the mechanism. So for example, if you have the treatment of peptic ulcer disease in the bottom right-hand corner, you'll see it so often that you eventually remember that, triple therapy through clarithromycin, azithromycin, and like a PPI is the way to go. Furthermore, now these mechanisms can be either handwritten or you can make some sort of digital version of them. If they are handwritten, you can always convert them to a soft copy and keep them for later. And you can have this mechanisms folder that contains all of them, right? Any questions so far? Okay. So now, how do you construct these mechanisms? So what I suggest is that you do mechanisms in PBL. Let me just check, with the online learning, is that still the case that you make mechanisms, or is that no longer possible because you don't really have a whiteboard? Sorry, I wasn't exactly sure.
Yeah, we still do them. It's kind of not as good in person, but try to still online, yeah.
Yeah, at least to some extent. Yeah, so it might vary group upon group, but if you do, it's great, and you can use those mechanisms as a base. If not, you can find similar mechanisms online. Now, in particular to this course, right, and the course material that you are provided, I think it's really important to look into those case notes and the parts of the patient history including the risk factors, investigation, treatment, and management specific to the PBL materials that you have, because that's what's going to be examined later on. Other mechanism resources can be very useful, like Calgary guided med maps. They have these mechanisms that are already there, and you can use those as bases as well, or as like a supplement to your own mechanisms. And some further research can be useful. Now, so for examples, unfortunately I don't have any PBL examples for first year, and I apologize for that. But I'll just quickly explain like the idea of like osteoporosis, which is what you might encounter in second year. So essentially, bone is, when you're young, is quite dense, but over time, there are factors that actually result in a decrease in bone density, right? And bone, which is involved in weight bearing, can eventually break if it's quite porous and it's not, and if it doesn't have that density, right? So that's essentially like the complications of osteoporosis. Porous bone leads to fracture, right? So it's a fairly simple sort of concept to understand in any case. But I guess the real purpose of this slide anyway is to just discuss like the different ways in which you might construct it. So you can write like the PBL, the title at the top. The risk factors can be in the top left-hand corner. Now for osteoporosis, it's being like female, if you smoke, if you're postmenopausal, right? And then you have this whole part about the pathophysiology, right? So like estrogen like deficiency leads to increased osteoclast activity. Now osteoclasts essentially just take away bone, right? Now all of these factors lead to bone resorption, lady gets a fracture, and then there's various different sort of complications of that, like decreased height, decreased mobility, of course, right? Now there's going to be quite a bit of space on in other parts of the page, right? And what you can fill that up with is things like the diagnosis. So for example, she has like a bone scan, she has an x-ray, right? And also treatment and management points that are specific to that PBL case, right? So for example, you can give like things that build up bone or something that decreases inflammation, right? And some additional notes you can put in here. So that's one example of like a PBL mechanism, right? This is another one. Now, you guys studied a little bit about, I guess, the structure of muscles. So essentially, there's this idea of like muscular dystrophy where you actually lack something called dystrophin, and essentially, like the whole like skeleton, the whole structure of the muscle isn't as good as it should be, right? So there's a lot of fragility in it. And essentially you get this sort of necrosis because calcium floods in and degeneration and all that, and that leads to like weakness. So then people can't walk properly as a result of that. So again, risk factors, a really sort of detailed mechanism and a diagram, right, which is also quite handy in the corners of it. All right. Does anyone have any questions about this so far?
I have a question about when is the right time to make a mechanism? While I'm studying or after I finish?
Yeah, what I personally recommend is that you do it soon after you finish your PBL, right? Personally, I did them like right after because that was when it was fresh. I remember the content, and I'm the type who like, you know, if you don't do it then, you won't do it, right? So I think it's quite helpful to just do it then and there. But you might find it useful to do it later. By doing it like sort of then and there, like you don't have like a backlog of things to do, and you already have it prepared for your final exams. So yeah, I'd suggest to do it earlier personally. Okay, any other questions?
I have a question. How long roughly, sorry, I'll turn my video on too. How long roughly do you spend doing this, and what's a reasonable kind of time that we should be aiming for it?
Yeah, that's a really good question because, you know, time is of the essence a lot when you're studying. So I think I spent maybe about an hour per mechanism, right? So the thing is, a lot of that, the mechanism is sort of already there if you do it in the PBL, right? So you just write that up and then you read up on like the specific risk factors as treatment, management, investigations for that patient in the PBL notes. You sort of write it down. I think the long part is really just like scribbling things down and annotating it, etc. Yeah, so it only takes about an hour or so, but you know, it does go a long way. Yeah.
Thank you.
No worries. Any other questions? Okay. So I do have some examples for first year. Okay, so acute and chronic inflammation. Now, this is something you'll encounter like forever. So acute inflammation is on the left, chronic on the right. You can compare the two, right? With acute inflammation, the causes are quite, and acute and chronic inflammation, the causes are quite similar, but of course with chronic inflammation, it's over a longer period of time. So you can see how you have your causes, a mechanism as to like the cellular reaction, how you have like increased vascular permeability, mast cells, histamine, and damage essentially. And the same for like chronic inflammation, except you get more like macrophage sort of and fibroblast proliferation resulting in collagen deposition and so forth. So it's definitely applicable for your physiology as well. Okay. Now, another way you might present it is using a diagram. Now, I tend to think that people remember visual things a lot more easily than, say, words. Sorry, there is something in the chat. 1 second. Okay, so Shaf said, if you're unsure how to start, we used to take the mechanisms. Yeah. So you can take out some of the quote unquote low yield information and add in the treatment and management. Sometimes there is too much specificity in terms of like what people present. Like say like in this randomized controlled trial, they found this versus basic details, right? At least to the extent of which is covered to the level of your lecture and but not too specific, in my opinion. Any questions about this? Okay. Sorry, was there a question? Okay, might just be a bit of a sound. Okay, now another thing that is quite useful, I would say, is compiling the case notes. Okay, so what you can do is that you can copy and paste the notes from LAMS Learner. So you can like highlight it, Control C, Control V, and put them onto a document. The importance of that is that the people who write your PBL are likely to be the ones who mark your exams as well, right? Or they, you know, there's a bit of like crossover between the two. So they'd be looking for the specific investigations that they wrote up in that PBL. Now, this is an example for your first PBL in gastro, which is on peptic ulcer. This is actually a
Anyone else frozen? Yeah.
Yeah, I think he dropped.
Oh.
We're both streaming out of Bathurst and Lismore, so it's a little rural, but oh well.
Shaq, do you want me to have a start, and then if he comes back, we can just go back to him?
Yeah, I'm not sure how long he'll take.
Should we give him a minute or two?
Yeah, give him a minute, and I'll just quickly send him a message as well.
My internet also just dropped out, so it might just be the rural business.
Yeah, mine did as well. I mean, you and I have the same internet, but Kevin shouldn't. Who knows?
Hello, sorry. Did I drop out for a bit?
Yeah.
Sorry about that, guys. I'm in like a really far rural town, like 6 hours from Sydney, so the internet's not the best here. But I think things should be all right now because I've connected to my hotspot, which is a bit more reliable. Okay, so you got the investigation results, right? Also note down the pictures with it, because often what they do is that they use those same pictures for your exams, okay? And you're like, and they're like, oh, what is this showing? And then if you get that gastroscope image, you can say, oh, it's a large ulcerated mass. You see a visible oozing ulcer, etc., right? If you go verbatim and it's the same picture, you definitely get it right. And then you could write down the progress. Now, this is for that osteoporosis tute in second year. So essentially, you can copy down those the entire sort of lambs for that, right? In which case you won't miss anything. You have the learning outcomes here, the investigation results, the X-ray, MRI, and also like sometimes they do give you a mechanism as well, which is actually really good because that's probably what they want. Any questions about this in terms of like, say, copy and pasting things and PBL notes? Okay. Again, I used to do this like immediately after the tute or soon after. Okay, now condensed notes is another way to approach things. So it's a lot easier to, it can be a lot easier to digest a shorter series of notes than say like 500 pages of just random stuff that isn't well summarized. So for example, you might have a lecture on prostaglandins, mucosal protection, and NSAIDs, okay? So you can list learning objectives on the top left, you have your gastric mucosal barrier, and you know all the different parts of that lecture. And this is all summarized in one page, which I think is quite useful, okay? Instead of like say 40 slides to remember, it's all on one page. Alcohol in the liver, this is another example. You can include diagrams, you know, and all the different aspects of that lecture then which you were trying to encapsulate, right? Some of the techniques you can use to sort of abbreviate things into like a shorter series of pages is like just shorthanding words like CONC for concentration. Any questions about this? Oops. Would you guys find it useful if I, say, shared these super summaries with your group?
Hell yeah.
Yeah, so I might do that after this. All right. So now in terms of like other tips, I have to say that, you know, mechanisms and condensed notes don't really cover everything. So I think it's really important that I touched upon these concepts in terms of studying in general, right? So I think at least in preclinical years, it's really important to know your physiology well. Really, really important. And yeah, it'll carry you for the rest of your career in medicine. So Jesse just said, it's hard to know what the most important things are in the lecture. Yeah, they will ask niche questions, unfortunately. It's really it's hard to sort of prepare for, but you sort of do your best. Like you want to cover the most important high yield concepts first because they'll pop up in MEQs and stuff. So the multiple essay question thing you have in SEM 2. The little facts, I guess, you know, through time, if you do have the time to study them, you want to bring them. So back to physiology, what I recommend is like Dr. Najib's lectures. He has these long videos that seem sort of like quite lengthy at first, but I think they're worth the investment because you remember them for a long, long time. He covers them in a very crystal clear fashion. It's very, very clear and it's very diagrammatic as well, so you remember them quite easily. Furthermore, spend some time looking for the right resources before you start off a block, I would say. It will save you a lot in terms of time. So for example, with cardio, there's a really good website called CV Physiology by Richard something that is very, very good. And there are sort of block specific resources. In terms of like physiology in general, what I would recommend is Costanzo Physiology and the board review series. It's very clear in terms of how it presents physiology. Guyton and Hall is quite good, and Boron as well. To me, they have their strengths and weaknesses. I think Guyton is a little bit wordy and Boron's a little bit too technical, but you know, they do have their own advantages. And you know, at their core, they're quite good. For pathophysiology, up-to-date Medscape, B&J Best Practice, AMBOSS, USMLE, and various guidelines are quite good. And also those two mechanism resources I talked about before. I'm in first and second year, I use Medscape a lot. It's quite simple to use. It isn't too complicated, doesn't have like several pieces of information about like RCTs and all that. It just presents what you need in like you know, the pathophysiology, etiology, treatment management stuff. So I thought that was pretty good. Anatomy, Moore's clinically oriented learning is very, very comprehensive. I would recommend the use of an atlas as well, like Human Anatomy Atlas. It's like an app on Android and iPhone, and also you can find it on PC and Mac. Teach Me Anatomy and also Rollins. Videos are really useful for learning and condensing things in a shorter period of time, like Osmosis and MedCram and Amanda Hasudigan. Okay, in terms of other tips, and I think this is my last slide, for exams, past papers are your best friend because they'll repeat questions quite a bit, okay? So always look at the past exam papers, right? And you might want to look at those questions like several times and how you respond to them, because they do pop up, right, invariably. Now, study groups may be useful, really, it's really up to you. Some people do find them useful, some people not. I think it sort of depends on the group dynamic. If it's more like friends chatting, sometimes it may be not the best use of time. But personally, I've found them quite useful. Now, I would recommend group study in particular for clinical medicine. Now, in first year, I think it's a little bit abridged because of the COVID situation, but later on, when hopefully it passes, you have to do like physical examinations on patients and histories and that's really useful. I would recommend creating like a Q&A group separate to your cohort page, just for like queries that anyone can sort of ask, right? And anyone can answer. It's really good to create that supportive environment. And last but not least, what's really important is like support each other and to help each other, because I think regardless of who you are, it can be quite challenging. And, you know, I think everyone does find it quite difficult at times to sort of study and understand concepts, right? So yeah, definitely support each other. And Paige just said, sadly to see they haven't repeated questions from past papers. Yeah, maybe that's because they've done that a lot already, but you know, there is still that potential in future exams for that to happen, right? Okay, so that's pretty much all. Does anyone have any questions about any of that?
I think in that case, we'll move on to Daniel and his flashcards. And if anyone does have any questions, I'm sure Kevin will be happy to take them over Facebook, or you can send them to me as well.
Yeah, feel free to like message me if you have any questions or concerns. All right, thanks guys.
Thanks, Kevin. Next up, we have Anki / flashcards, given to us by the Anki whiz himself, Daniel Hazan. Take it away.
Hey guys, so my name's Daniel. I'm a fourth year. I'm in Lismore with Shaf, and I'm going to be presenting with a mate of mine who actually doesn't go to WSU. He's a UNE med student. His name's Josh, but he is a bit of an Anki whiz himself, and he's sort of I've sort of got more knowledge about fourth year, third year stuff with Anki, whereas he's got the full kit and caboodle. So I'll go ahead and share my screen, and I'll get him to input throughout. All right. All right. So for many of you who don't know, I'm sure you guys have heard at least, Anki is a flashcard app. It's used pretty widely by med students, but also, you know, other disciplines use it as well. It's used in the States specifically, but slowly more people in Australia are using it. So I'll get right into it. So basically what it is it's this idea of active recall, but it uses these intervals, spaced time intervals. So for example, I would do a flashcard the first time, and then maybe a day later I'll get it again, and then 5 days later I'll get it again, and then 2 weeks, and then 4 months, and then I don't know, a year. So it just depends, and you can choose which intervals. You can change your interval settings, but it's a really good way for, even if you didn't use it for med, just for any sort of study or any sort of thing you want to learn. People use it for languages as well. So yeah, this is the goals of hopefully this talk, is learn how to use Anki well. Learn how to make effective cards. That one's a really hard one. It's taken me quite a long time. Even now I'm still learning. Maybe get a pre-made deck. I'll have a talk about that. And you need to remember, probably one of the most important lessons, is to commit to doing the reviews every day. So I'll explain what that means. So basically, like I said, you have that card, you do it for the first time, and then a couple days later, you'll have it again. So that's called a review. And the most important part of Anki is you don't just do the cards once and you just don't cram them, because Anki is about using your time effectively, doing it over a long period of time. And we'll go through the pros and cons of that kind of stuff. This is what I wish I'd known, and Josh as well. We kind of collated a slide. So in first and second year, I was pretty crap at Anki. I was just kind of meandering around. So yeah, so you need to do reviews every day, like I said. If you're doing your own cards, you can consistently add new cards. We'll get into the nitty gritty of that. There's this special playlist by this guy called Anki on YouTube. He has this 20 rules of learning. I'll link that to you guys later. And he's also got this special manual. And then something that I recently picked up and I told Josh about, because he hadn't actually done, is you need to remember to sync your decks. So I'll go through that as well when I go through a little hands-on tutorial. Don't do too many flashcards in a day. You will regret it the next day. It's kind of like drinking. So you do too many in a day, like that, maybe that feels great in that day. Then you have to do so many reviews the next day, and then you want to do new cards that day as well. You're going to be completely overwhelmed. Oh yeah, sorry, I forgot to say, if you have any questions, please interrupt, like preferably talk, but you can also message as well. Don't make cards for every tiny detail. So Anki is about, I'm sure you heard the term a lot now, high yield. So you want to make sure you're not doing small random details that you're never going to be asked, like maybe something you want to flex on the consultant when you're in third year onwards, but like, it's all about getting the most important things down. Obviously that's different for each different person. It depends how good you are at memorizing things, etc. And it's also important not to memorize without learning, because you have these little sort of flashcards and sometimes you can remember them visually, but you won't actually take in the information. You'll just see visually where that is spaced on the page. And yeah. The other stuff you'll kind of pick up as you go. You can always visit this back. Do not skip days. So yeah, same thing. Always do your reviews. All right. So the Anki algorithm, this is really boring. I'm going to go through it really quickly, but basically, let's say I do a card and I don't know it. Maybe it's the first time I've done it. I'm going to click again, meaning I want to do it again. It's going to give it to me back pretty soon. Let's say I knew this really well. I click easy. It might give it to me like quite a while away. And you can change your interval based on how you do it. I personally use just the basic settings, but a lot of people experiment on it and you can change it however you want. So skip through that. All right. Yeah. So this is the playlist I was talking about. I'll link it to you guys. I'll send it through to Shaf. Maybe he can post it for you guys. This is the Anking playlist. So he basically, amongst a bunch of other people, have made these decks. This guy has really fleshed out this YouTube tutorial. There's a lot, but it really teaches you the basics, like way more in depth than what I'm going to show you. I'm just going to show you the basics you need to start learning. He can teach you a lot more. So you'll see that later if you want. Those are the three most essential ones, I'd say. Okay, so here's where we get into the actual content relating to med school. So Josh is going to talk about homemade decks a bit later. I'm going to talk about pre-made decks. So with Anki, there's two sort of main approaches, at least in my experience. You can make your own cards, which is great. It's time consuming, and we'll get into the pros and cons later. Or you can use pre-made decks, which exist on the internet. A lot of them have been like verified properly. People swear by them, would live or die by them. Here's just a quick example of some of them. So the first one that was ever created was called Brosencephalon. It's sort of, over the years, different people have added on, and there's Zanki, which is the one I use, and Josh uses that one as well. And then they've sort of been amalgamated into Anking, which is supposedly, some people say, the best one. It sort of depends what you want. Zanki is a bit easier to use, but if you want to be like the biggest gun in the world, maybe you'll use Anking. I don't know. Okay, so this is how you use Zanki. So basically, you need to make sure you have all your add-ons. I'm actually going to go into Anki now and show you. Make sure you have add-ons. I'll explain what those are later. You need to make sure you do it via blocks. So for example, just how we learn in med school, we learn like cardio, gastro, MSK, whatever, however you learn it. You don't just want to go and do all random cards in Zanki. You want to make sure you're doing them block by block. So, and then the way I do it is I start with the physiology. So you start with the building blocks, just basically like we do in PBL. And then you go into pathology. And then if you're really interested in pharm or histology and you really want to be good at like just, I don't know, crazy gun, you can go into pharm or histo. So I'm now just going to, let me know if you guys can see me open Anki because I'm not the best with Zoom. Can you guys see that? There's this, yep, okay, fantastic. Sorry, yeah, there we go. So here I made a separate profile for you guys. So here is the step one. I'll explain this part now actually as well. So like I said before, Anki is started in the US, or Anki at least started mostly in the US for med. And in the US, they use a system called USMLE, where they have a whole bunch of different exams. It goes step 1, step 2, step 3. And step 1 is sort of year 1 and 2 level. Step 2 is 3 to 5. Step 3 is like internship resident level, that kind of stuff. So you guys would be starting with step 1, seeing as you're in first and second year mostly. And it basically just goes through, I'd say in depth, it's maybe slightly above what the School of Med gives you, but I don't know, like they're pretty similar. And so I'll show you, let's say, what block are you guys on right now? Are you on cardio? Yep. Okay, cardio. Oh, I've got a lot of chats. I'm very, yeah, hang on, let's look. Yep, okay. Fantastic. Is IF meant to be ID?
Yeah, sorry, we just started infectious diseases.
Okay, yeah, sure. So I'll start with cardio. There's some ID stuff as well here. So what I'm going to do is I've got this deck that I've downloaded already. And I'm going to go in here. I'm going to go browse. This is very important if you want to use Anki, so I'd watch this. So you go browse. So that basically opens the menu for all the cards that you have available. And now I've downloaded this add-on, which I will show you how to do in a sec, which has organized the cards in a specific way that makes it really easy for me. So what you'll do is if you download the hierarchical tags add-on, you'll go into #Anki. Then let's say I really want to do, before that, sorry. What I'm going to do is I'm going to go like this because I've opened the whole deck. I'm going to press enter. What that does is that just searches throughout the whole deck. So I've got the whole deck available to me now in the search bar. I'm now going to go Control A, or you can just, individually select all if you want. It's going to take a sec to select them. And what I want to, hang on, I unselected it. What I want to do with that is I want to then suspend all the cards. So the way you can do it is Control J, which will suspend all the cards, meaning I won't do them. I won't be able to do them unless I unsuspend them. And that's important if you want to do it block by block, because this is sort of it's a bit of an open source, old school program. Like it doesn't have a great user interface. You kind of have to figure out how to use it. All right, so I've now suspended everything. Now I've decided that I want to start off by learning the physiology, like I said, and I'm gonna go to wherever cardio is. There we go, cardio. So now I have all the cardio cards selected in here, right? They're all suspended because I suspended all the cards. So I'm gonna go Control A, right, to select all those cardio physio cards and go Control J. So now they're unsuspended. All right, so all those cards, I can now access them when I want to do the deck. So I can click X here, right? And there's 20 new cards available. You can change how many cards you want to do by going on the settings. So you can go settings here, options, but I'm fine with doing 20, but let's say I want to do 30 cards a day. Those are 30 new cards a day. So, right? So I go here and I start and I go study now. So it's going to ask me if it works. There we go. How does the cardiac output of the left heart compare to the right? So does anyone want to tell me the answer to that? No? Okay. So the left heart is generally, it's got a bit of a stronger beat to it than the right, but in a steady state, they're equal. Okay. So this is the kind of shit which is a bit low yield, but Anki will take you further in terms of depth, like level and depth, right? So then I would go, right, I didn't know that very well. I thought that left heart stronger than right heart, right? So I would go down here to the bottom and I could click again. Or if you want to do it differently, you can press 1, which is equal to again, 2, which is equal to good. Those are the shortcut keys, and 3, which is easy. So I didn't know that well. I'm going again, right? The rate at which blood is pumped from either ventricle is called the, right? Let's say I really don't know that. Oh, what's that? Oh, that's cardiac output. Okay, I would click again. Okay. And then let's say I really knew this card. Oh, I know this very well. I'm going to go good, right? So what happens is The ones that I've clicked again for, they're going to show up in like 1 minute, right? As I keep going through the cards. The one I've clicked good for is going to show up in 10 minutes. And the one that let's say I really know that the oxygenated blood flow from the lungs to the left atrium is via the pulmonary vein, I can click easy. I'll see that again in 4 days, right? Okay, so that's basically how Zenki works. You start off by going block by block, physio, then pharm, as a physio, then path, sorry, and then maybe pharm or histology, doing cards every day. You can increase your limit. You can do it however you want. You could do 10 new a day if you want, but you always make sure that you do your review cards. So tomorrow, I'm going to have maybe one card in here because I haven't gone through the whole deck that is due tomorrow, right? And I need to make sure I do that card again and keep consistently doing those cards that I've done previously when they turn up. Okay, so that's how doing Zenki works. I'm going to go back to my presentation now. Load. Anyone have any questions?
How do you get the Zenki in the Anki?
I'm gonna send that to you guys. Don't worry. So I'll also get into where you can get all these different decks from, but I'm happy to I've got a Google Drive with them. Yeah, that's how you use Zenki specifically. Anking works quite similarly, but I find that it's a lot harder to unsuspend and suspend cards. That's the main reason I use Zenki, is that I can do it quite easily. Whereas in Anking, they have all these different sub decks and it just gets so confusing. And I don't really want a part of that. But if you're bothered doing that, it might pay off more. So here's my sort of list that Josh and I came up with together. So pros and cons of pre-made. So the pre-made cards, obviously you don't have to make them. So there's no time involved in making the cards. I find it's less stressful. When I get home from at least hospital rotation, but even from uni, I always had this idea that like, okay, great, I know what I'm going to do today. I don't have to go and go, oh crap, do I need to study this? Do I need to study that? I know that I'm doing cardio. I want to finish all the cardio physio cards and then go on to the path ones. So I go home and I go, yep, I know exactly what I'm doing. So there's no stress involved in choosing what you have to study, mostly. Sometimes you have to study outside Zenki and look up specific things online, whatever. But for the most part, I knew what I was doing every day. There's a very good breadth of knowledge. And if you really wanted to, you can sit the USMLE STEP exams. So let's say, I don't know, for whatever reason, you're doing some very competitive surge. You want to be some very competitive, like you want to be a plastics surgeon. And you decided, oh, it's a bit easier to do my plastics fellowship in the States. Then that would be a reason why you might want to sit STEP. I'm not saying you should ever do that. Like if you're bothered, that's your thing. And then there's cons, which is it may not cover university specific content. So I remember like in some of that like Aboriginal health stuff, they have like specific quotes for specific like massacres and specific whatever they've got, like this terrible tragedy happened. You have to know those specific things. So it won't cover like PPD stuff that might be examined, or it might not cover some of the pop health stuff. So there's a lot of university specific content that you will have to learn, but most people cram that before the exam anyway. Sometimes you'll come across terms that you really don't know. And it'll be the first time you see it. You'll have to do a bit of research. And if you fall behind on reviews, it can be very stressful. I've done that 2 or 3 times and I've managed to catch up, but it is a very, like, it's not a very nice feeling. Josh, did you want to give any input here, or are you good?
No, you pretty much covered it. Okay. Yeah, it sort of like overlaps with the homemade. So
yeah. So if I remember correctly, so here are my recommended decks. I've done Zenki. I'm currently doing Zenki step 1 and step 2 sort of at the same time. So I'll do topics that I haven't done before that are like sort of entry level in the step 1 deck. And then step 2 is sort of that clinical knowledge added. It expands on step 1. And it has some extra things. So for example, you don't really learn about O&G in years 1 and 2, so obstetrics and gynecology. But in year 4, that's one of the rotations that everyone has to do. And they have an O&G specific deck. They have a PEDS specific deck. They also have a step 2 general surgery deck, which is important maybe in year 3, because most people will do general surgery. Then some other decks, I think Josh uses Netter's anatomy. I used it once. It was pretty good. Josh, do you have anything to add on?
Yeah, I'm a big advocate for Netter's. With Netter's, it like breaks down all the anatomy into subgroups. So it's like really easy to suspend and unsuspend cards depending on what you're doing. So at the moment, we're doing gastrointestinal. So I can just have abdomen. I don't need to look at any heart, any lungs, that kind of stuff. Just have abdomen and learn it all super easy. It's got like a lot of explanations. There's even little blurbs under most of the cards of like the clinical significance of the spot. So if you have like appendix, or if you have like one of the organs, it like says what's important and what to look for. So yeah, I rate Netters.
So Jesse, your question, how much time do you spend doing Zenki per day? It depends. So some days when I just do my reviews and I can't be bothered doing new cards, it can take like 30, 40 minutes max if I'm just like sitting down and focusing on the cards. But I can even do them throughout the day, like at the hospital. If I'm like, let's say I'm not scrubbed in, I'm in the corner watching some boring ass lap collie that like I'm not remotely involved in. I can sit there and do the flashcards on my phone because there's an Anki phone app. So for iPhone, it costs money, but for Android, it's free. So it's hard to say exactly. Some days, let's say I'm going up to exams and I really want to finish something, or I'm doing some of my own cards. I've gunned it. Like I've done, maybe 6 hours in a day, but that's not like your average day. That's like, same as you would cram anyway. So I'd say, you can spend I'd say if you're just doing them casually from the get-go and you've got a lot of time, I wouldn't be doing more than an hour and a half of Zenki a day. Otherwise, you're probably going a bit too hard.
Yeah, so I've done my Zenki today, and just doing Zenki alone, 92 minutes, so an hour and a half, pretty much. It tells you on the in Anki how long you've spent. So I've finished my Zenki for today. It's 92 minutes.
Do you do like extra stuff? Sorry, do you do like Zenki and then like extra other study as well?
Yeah.
Yeah.
Do you want me to share my screen and just show you what I've done today?
How about after I do this?
Or later, yeah.
Yeah, so we'll show you that. So I'll get into that as well. But I do some other decks. So light decks for specific decks I've got here. So me personally, I'm a little bit interested in ENT, and Light has made a very good ENT deck. So I do my Zenki, and then I do a little bit of Light's ENT every day because I'm on doing some research and I'm struggling to understand what the hell they're saying in the research meetings. So I want to sort of look at least somewhat competent. Another message. Daniel, how much overlap do you get between Zenki and WSU lexicon it? That is, if I did only Zenki, roughly how much by lexicon it? Okay, so I can't give you a specific answer, Will, but I can say this. In first and second year, I did basically no Zenki. I passed. Yeah, hi Liv, I'm in a call. I did basically no Zenki, and I passed. I got credits, and I'm happy with that, obviously. But I put in a lot more effort than I think maybe a credit deserved. In third year, I started getting distinctions, and this year I've started getting high distinctions because I've been using Zenki. But I have a friend who used step 1 and step 2 in second year, and he went from getting like credits to high distinctions as well. So, at least in my experience, it's enough, if not more than enough. Obviously, you're not always going to be able to cover anything, but I would say that with almost any form of study. If there is something that you've done, and the other idea that I forgot to mention is that let's say you have your cardio block, you want to ideally have finished the Zenki cardio cards, at least gone through them once before you start that block, right? So the reason that's important is because if there's something that you don't recognize there, you can make a card on that. Right, so I'm not sure what block do you guys have next?
I think cancer for second year and RESP for first year.
Okay, so RESP is a really easy example. Well, I've got another message. Yeah, RESP. Yeah, so you could just start by doing the RESP physio questions, and there's a couple hundred cards. If you let's say you did 50 a day, you get it done in a couple of weeks before RESP properly starts. And then once RESP comes around, you can go, oh, like I didn't know that about RESP physiology. I didn't know about, I don't know, hemoglobin and oxygen and the curve and the dissociation curve. That's so interesting. I'll make a card on that. So you can always fill in the gaps. And then the final thing I want to say about recommended decks is you should follow the subreddit. So I don't know if anyone knows what Reddit is. I'm assuming there's got to be at least some nerds here that know what Reddit is. So it's basically, there's a specific dedicated subreddit called r/medical school Anki. And they have this very comprehensive guide on what decks to use. It has links to very different decks. So it has links to the Zenki decks. I'll happily give you guys the Google Drive for my stuff though, no problem. It has the light decks on them, has the anking decks, has everything. And there's people who ask questions about how to optimize your anking. So let's say you had a question, you could ask it on there. A lot more people know more than I do. So I'm sort of entry level at this stuff, and it's taken me a while to get there. and I didn't properly get into the subreddit until like third year. All right. So homemade cards. So this is where I'm going to get Josh to sort of jump in, but this is the, oh, another question. Oh, no worries. So this is the two main schools of thought when it comes to making your own cards. So I do the right one, which is attend lectures, make the notes, make the Anki cards in lectures, then ask questions at the end of the lecture. I was always that guy that went up and pestered the lecturer, like got to the point where like it was a bit of a joke. Like you could hear me in the end of every recording. Yeah, it's a pretty sad life. And then you want to do your flashcards consistently. So Josh does the left, I think. So Josh, do you want to speak on that?
Yeah, so what I do is, because I haven't fully committed to Zenki, well, I have fully committed, but I like to make my own notes as well, because I feel that often lecturers will say like, you need to know this for the exams, or there would be a question like this in the exam. So I make my own notes with what I consider like high yield information, I guess. So I attend the lectures, ask questions, and I just type up notes like in a Google Doc as if it's a regular lecture, like nothing to do with Anki yet. So I just type my notes, what the lecturers say, any information I find necessary. We have learning points. I don't know about you, but we have like learning targets. So I try to answer all the learning targets with the information in the lectures. And then at the end of every week, I then go back through all of the lectures and make my own cards. And I find that that's pretty good, because when I go through all the lectures and make my own cards, I just try and extract like the little pieces of information that I think are the most important. And it also counts as sort of my first like revision going over the lectures. So it's like the first time I'm seeing a card is when I'm making the card, and then it'll show up again when it is actually supposed to show up in Anki.
Does anyone have any questions on that? How many cards
per lecture?
Oof.
Usually I get about maybe like 10 to 20 per lecture, if that. And then I have it set for me to do 30 new cards a day. So if I do all of my lectures at the end of the week, I don't know how many lectures you guys have, but if I set all of those cards at the end of the week, I'll finish all of the new cards by the next week. Like I'll have seen them all again. Because yeah, I'll only have like 100 or 150 new cards every week, and that'll take 5 days to go through to see them all.
It also depends how you make your cards. So yeah, Josh makes larger cards. I'm more of an advocate for small cards with small things. So let's say, for example, I don't know, I was talking about like pancreatitis. Sorry, it's just a random thing that I was thinking about today. Like I could have a card where it could have the causes of pancreatitis only, whereas Josh, I don't know, I'm not sorry if I'm misrepresenting you. Josh might have a card which has like the cause of pancreatitis is this and the symptoms are blank. Yeah. Whereas I'm more of a small card person, so I will generally have more than that. It depends, and you should sort of have to figure it out yourself about how you best respond to cards. I initially started off like Josh, and then once I started doing Zenki, and Zenki is more of a short card type thing, I adapted to that because I found that I learned those better.
Yeah, so what I find is Zenki is really good for the short one piece of info kind of cards. And then I want to make my own cards a bit more challenging. So I try really have to like understand what's going on to be able to answer like every point in my card.
Oh, whoops. All right. So yeah, here's the pros and cons of making homemade. So actually making the cards does help consolidate knowledge. Josh mentioned that. That's the first time when he makes the card, that's when he starts learning it. You can choose, only do the high yield stuff because you're making the cards. So some of the Zenki is like a bit of random crap and you may not want to learn that. You can make it specific to unique content or to, let's say textbook content or to whatever you're using as your device. I don't know if you really like, I don't know, Armando Hassan-Dugan, for example, like that could be your thing. And you get to write the way you like. So in relation to that as well, there's another pro that I didn't include, which is you can make them with your friends. If you trust your friends, like the way they make the cards, then you can sort of collab. Daniel might do week 1, Josh might do week 2 or whatever. And that way you're not spending all your time making the cards, but then you lose that sort of making the cards initial learning sort of process.
Yeah. So I always like to make my own cards because it helps consolidate, but there are a lot of people in my cohort that just divide the lectures up and then just send each other their cards at the end of the week or whenever, and you can just throw it straight into Anki and start them straight away.
And then cons, obviously quite time consuming because you got to make the cards, then you got to do them. I think I only properly mastered that or started like having a proper go at being consistent in Sem 2 of year 1. And then like even then, you know, it was really, I only really started to get going with it in year 2. So it takes a while to get used to it and how to be efficient. So that the reason why I started making the Anki cards in the lectures is because I didn't want to have to do that, to make the notes, then go after and then make the cards and then learn the cards. Whereas Josh is probably a bit more efficient than me. I like to procrastinate. So not the best for that. The cons is sometimes you can overlap, like different lectures content overlaps. So you could make a card about something and then make that same card later on. Luckily though, if you make word for word the exact same card, Anki will tell you. They'll be like, this is a duplicate. But I mean, I don't know how perfect you are at knowing yourself, but I don't think I always say exactly the same thing. And then the other thing is it's dependent on the quality of the resources. So look, I'm not trying to trash WSU. Sometimes the lecturers, certain lecturers, do not really teach the topics very well. I found that some of the anatomy content was difficult. Some of the embryology content was a bit difficult. I'm not going to call out lecturers. You know who they are. Some just, yeah. I'm looking at Shaf's face right now. He's very stoic. So yeah, so that's always dependent on that. If you're making lecture content, know that it's specific to the lectures, and if there's a mistake in it, which there were in some of ours, then that could be the case. Anyone have any questions in that in regards to that? All right, so here where I get onto the add-ons. So an add-on is basically sort of a way of customizing your Anki experience. There's a couple that are necessary. I don't think you can function without them. That is a hierarchical tag. So basically what that does is the guy who makes Anki, he organizes his tags in a specific way. So for example, let's say it's a card about gastro, he'll have a tag at the bottom which says gastro. So he, to do hierarchical tags, it basically orders them into subdecks. You need that if you're doing Anki step 1. Anki step 2, you don't need it, but I still recommend you download it anyway. Image occlusion, if you want to make your own anatomy cards. So Josh might show you that. I don't know, I might as well, I don't know. You can use image occlusion, it's really good. Basically, let's say you have a diagram of, I don't know, the heart. You can blank out certain parts of that diagram and then they'll show up as an individual card. So it's very good. And there's the Amboss add-on. So if anyone has Amboss, I find this really good. I'm actually going to show you this right now. So it's really good if you're doing Anki as well, but also homemade cards. Let's say I don't know what cardiac output is. The Amboss add-on will tell me what cardiac output is. It's a measure of the amount of blood volume ejected from the heart, right? But it's really good when you've been through a lecture or something and they've said some random term and you just copied it down, you didn't really understand it. And you're going through the card, you go, hang on, I didn't actually know what that is. I'm just going to put my cursor over it. You do need an Amboss login for this, but you guys can probably share that. Not saying I recommend doing that. I don't know how dodgy that is, but I have done it and still do it. So yes. Yeah, so that's the essential add-ons. Josh, you had one more for that, didn't you? Or was that in the next one? Extra add-on.
I think it's probably in the extra. But in regards to the Amboss add-on, I don't have an Amboss account. So if I'm ever doing that, I just have to look up the thing. So the Amboss add-on does like streamline that, make it a lot more efficient.
Also, if you log in with someone else's account on Amboss, like I don't even think they count it as like you properly logging in elsewhere. Like I don't know if that makes any sense. Like that's how it works in my head. So it just like I've given so many people my Amboss add-on just for the Anki thing. So I think you can get away with sharing multiple accounts. And we share, like me and my roommates here, like there's probably like 7 of us sharing one account and we've never been pulled up on it. So I know people worry about that shit. And I really probably shouldn't be advocating for that. But yeah, so the extra add-ons is if you want to be really competitive, you can do it with your mates or with worldwide. There's a leaderboard add-on where you can actually see who's done the most cards for the day. There's one in med only, there's one worldwide, there's one in Australia. You can make your own personalized one. Josh has this, I actually haven't downloaded it yet. But Josh once I think came 3rd or 2nd in the world or something in med, or I don't know. Something messed
Yeah,
up.
I was cramming for. Okay, so don't do this. Don't cram. But I was cramming for exams because I was way behind on my cards. I smashed out like I think 1,200 cards in a day or something. Took me like 10 hours. Not fun. Highly advise you don't do it.
So Ali, yeah, it says what's the W? So I actually haven't made one, but you can make one with your friends. I think.
Yeah,
I don't know.
there's no like specific med school ones. It's just med school. You sign up.
You can make your own ones. Like there's a way to do it.
Yeah,
All you have to do, by the way, to access any of these, look up Anki leaderboard add-on. Like it's very simple. There's a heat map, which is now inbuilt into the iPhone app, but it basically just shows you if you've done your days consistently. There's a colored buttons one, which is for the computer only, just so that they're, the buttons are colored. Like if that's your thing, Josh likes that. And you can, it's not really an add-on, but you can change your, I got another question. How do you download the hierarchy? Yeah, so it's an add-on. So you can just Google Anki add-on hierarchical tags, and it just takes you, it has a, it explains exactly how to do it. Like it says in the Anki have a specific website and explains how to do every single add-on that there is.
There's just a little code that you have to copy and paste into the Anki app on your computer.
I'll show you where to put in the add-on, but it's like, yeah, there's specific codes that you have to do. And then you can change your cards format. So Josh doesn't like when I have my like purple background or something. He likes lavender. I don't know. So you can change what color.
That's the black background.
Oh, okay. There you go. Yeah. So you can change what it looks like. I really don't care. But yeah, if that's your thing, that's your thing. Yeah, so I'm going to try and keep this short because I've been going for a while and I really don't want to make people wait so long. So I'm just going to very quickly just do a very quick example with your lectures, just so you kind of know what that looks like. So I'm a big fan of John Morley. I'm going to get up his lecture here. This is exactly how I set it up, if it will listen to what I'm saying. I do half of the screen my Anki, the other half my PDF. The other thing that I do is I like to organize my lectures by week and block. So I would do, like, for example, I could create a new deck here. So I go create deck, cardio. Then I want to put the heart and pericardium in cardio and the cardiac myocyte contraction both in cardio. And then I could say this is week 6. So I could go create deck week 6. And then I'll do that. I probably didn't do that the smartest way. And I go like that. And I go like that. So now they're all in week 6. So I'll just very quickly go through cardiac myocyte contraction. I'll just choose like one card. Sorry guys, a bit lazy, but I'm really taking a while here. Yeah, so Stuart Head, he has a bit of a mess, in my opinion. The lectures were quite hard to understand. But let's say I'm going through and I see this slide has a lot of info on it. Cardiac cells are branch cylinders, 85 to 150 nanometers or whatever that is, approximately 5 to 10, blah, blah, with 2 nuclei. Like, that's just messy. Like, who's going to remember all that information? What I'll do is, okay, I'll get the high yield content. So I'll go, this is cardiac myocyte contraction. I'll go add, right? And I want to, choose. So you have to choose the type of card you want. The type of card I like is close, and I'll show what that is. So choose close.
That's the only card type I use as well.
Yeah, and I would recommend you guys only use codes that just close you make. So cardiac cells have, and then I want to choose, the card I'm going to make is how many nuclei they have. Now, this is actually false. This is the example of where the lecturer has led you astray. I'm not sure if this is our lecture from 2017. It might have updated it, but cardiac cells can have up to like 4 nuclei, I'm pretty sure. I think they can have 1 to 4 nuclei. Yeah, there you go. So I would put 1 to 4 nuclei, right? And then I would go here, and what you click is Shift, Control, C. And that will now make it a closed card. And what that does is when I get to that card, it shows cardiac cells have blank nuclei. The other way you can do it is you can not make it a close. You can make it a basic. Go here and you go, how many nuclei does a cardiac cell have? Then the answer is 1 to 4. Right? And then that will make it so that it's kind of like Quizlet, so to speak. So it shows up with that question, then you press for the answer and it will show up as 1 to 4. So let's say I did that.
That's like a physical flashcard where you have like a front and a back.
So here we go. That's what that looks like. How many nuclei? There's the answer. Right? And then if I knew that, I would do that spacing based on what I've showed you guys before. So that's an example of one. Now we'll just do an example of a quick image occlusion. Um,
Yeah,
so we're
Jesse is about to show you.
John Morley.
Image occlusion is adding a picture.
Yep. So let's just find a good diagram. That's a good diagram, sure, whatever. So what you can do is you can take a screenshot, and if you save that screenshot to clipboard, it's different for different things. For Windows, I do Shift Windows S. That lets me crop it and save the screenshot to clipboard, but Mac is different. You have to figure out what that is just by
On
looking
Mac,
it up.
you can just copy and paste.
Oh, there you go. Mac is better.
Command C, Command V. Oh, you don't even need to paste it. It just puts whatever your last copied thing is.
I've downloaded the image occlusion add-on, so I'm just going to go here. That's the top right, that little image thing. And because I've saved this to clipboard, it shows, oh, whoops, sorry. Let me not do that. It's giving me the diagram that I had. And then what I could do is I can decide that I want to learn this whole thing. So I can just blank these out. There we go. And then you can either choose to hide all, guess one, or hide one, guess one. I find hide all, guess one is the best because it actually tests your knowledge. So what it does is it will hide all of the labels and then you have to guess one of them. If you hide one, guess one, it shows what it isn't, so to speak. It's a bit of a cheat. So I'll show you what that looks like. So here we go. I'm going to click study now. And, oh, what's that? Oh, I don't know. That's the sternal angle. Fantastic. And then what's this? That's the second rib. So that's an example of how to do that. That's really good for anatomy ones specifically. And I think that's really the most of the presentation. Let me just go back and see what else I've got here. Yep, so that's an example with your lectures. Anyone have any questions on that? Sorry, I'm rushing through this. It's a lot of content and you can always message me. Nope. Okay. So here are the resources. r/medical school Anki, fantastic way to get all those resources. I mentioned them before. ankingmed.com. The guy who made Anking has his whole website. You can go through that. You can message me. Oh, 2 messages. I'm Daniel Hazan on Facebook, Hazan. Josh Linker on Facebook. You can message Josh if you want. How that was organized, do you do each lecture separately or do they group? I do them separately. Yes, dope anatomy. Yes, Ali. Correct.
I suggest Netters. I haven't used dope, but I would advocate for Netters anatomy.
So Nicole, I do that for every lecture. That works well for me if I want to find a specific thing. Some people will just do a cardio block. I know some people who, I don't understand this. They just do it all in one thing, like actually makes me feel sick. But if that's your thing, who am I to judge? I think just the best way to organize your own based off lectures would be like that. But if you're just doing sort of random cardio cards or random past questions, you can do that however you like. And then Ali, dope anatomy is good. I think someone said, maybe it was Josh told me that dope is very specific to the Australian sort of approach to med. It's good, but can you handwrite cards with Apple Pencil? I actually don't think you can handwrite, but what I do in regards to Apple Pencil, well, I don't have Apple Pencil. I have a PC, but I have a touchscreen PC. What I like to do is I have a whiteboard app, and on one side of my screen, I have my flashcards. On the other side of my screen, I have my whiteboard app, and I actually write out the cards. And I find writing helps, like, you know, it's a bit of an iterative process, and I find writing helps me memorize when I'm, rather than saying them out loud or just thinking them. So that's how you can use your Apple Pencil. I think Josh is going to maybe give you an example here.
Yeah, look, also, so on the iPhone app, let me know if you can't see anything, but on the iPhone app, you can also put a scratch pad on the bottom.
That's true. And you can change.
And then on that, you can just like write whatever you want.
And I think that works with Apple Pencil.
To practice your answer.
If Apple Pencil works with iPhone, which I imagine it would, like that would be dumb if it didn't, then that's sweet. You can do that.
No, but like people write on their iPads. Like it might, like the people that do the app version on their iPads, they just write the answer at the bottom, the same as with Dan said he has a whiteboard.
Make them with pencil, but to be honest, that takes a bit of time. I think you still want to make them typing them up. But when you do them, you can use the writing down method, which is something that I do most of the time. Yeah, except if I'm on my phone, I don't really do it like that. But when I'm on my computer and I'm sitting down for a big Anki session, I'll do that. Anyone else have any other questions? Oh yeah, I was saying, sorry, Netters is, in my opinion, superior. And Frank Netter is like the god of anatomy, in my humble opinion. Like he just has beautiful diagrams. I think he draws them himself. Like he just knows his shit, and he has his own flashcards. Like they're not digital, but he's just very good. Like dope anatomy is good, but yeah. How do we go about getting, oh, I will sort that out. You don't worry about that. You guys have enough stressful shit to do. I'll message them to Shaf within the next day and he should be able to pass it. Is that all right, Shaf? Is that good?
Yeah. I'll organize it all after we
Fantastic.
finish.
Yeah.
So sorry, someone said before, how do you organize it each lecture, or do they group together? I'm not going to bother screen sharing, but I'll just show you on the app how I have it set up. I've got like, I don't know if you can see it, but I've got each week and then a farm lecture, a path lecture, a physiology lecture. So I just subdivide it into that.
Yeah, that's
how I
another
like
good way.
have
I
on my
do it by
guide.
lecture title, but that works very well as well. As long as you're doing some sort of subdivision, I think that helps. And you can also do tags, but you guys should be able to figure that part out yourself. Otherwise, I'm going to be talking forever. My final slide is, oh, another message. Oh, no worries. My final slide is about my recommendation. I think the best thing to do is make your own in first and second year and also use one of the pre-made decks at the same time, like Josh is doing. But you can get away with just doing your own in first and second year. That was the main way I studied in first and second year. No, didn't really use any other method. Third year onwards, I think you have to use a pre-made deck because the teaching is, you know, at least in my opinion, if you're going to use Anki, you should be doing a pre-made deck in third year because it's sort of as you go. You don't really get a lot of explicit sort of, this is what we're teaching you, this is what's going to be assessed. You do block by block, and the step 1 and step 2 cards are very comprehensive, and so in terms of like the clinical presentations and stuff. So in third year, I would recommend, if you hadn't started Zanki already, to start Zanki or to start Anki. And then for specific things, you can use other decks. So yeah, like I said, ideally use a hybrid. Anyone have any other questions? Sorry for taking up so much time, Shaf. That's my bad. I'm very passionate about it, as you can see. Yeah, so you feel free to message me. There's someone else in my year who's also a bit of an Anking. That's Gabriel Osi. He said feel free to contact him as well. And I think, oh, you've messaged me privately. I think you want to message Shaf about that. Will we be able to access the recording later on? Shaf, someone's messaged that to me.
Yes, you will be.
Okay.
So don't worry.
Yeah, and just the final thing I'm going to say is, if you're very passionate about Anki, sorry about the funny title. I'm recruiting to Anki Sock. I just thought it'd be funny if it's Western Sydney Anki Sock. So it's Wanky Sock. Haha, very funny. I'm going to start making the society. It's going to be probably done in the next couple of weeks. If you want to learn about Anki, you want to teach your fellow brethren about Anki, or just, you know, want to get involved. It's not going to be a very big society. It's separate from WSMS, but it's going to be just med focused. I don't know anything about using Anki for other things. So yeah, feel free to message me, and I'll add you to the society when I make it. And yeah, that's kind of all I had. Please message me. Like, Anki is very hard. It's a very steep learning curve. I'm going to give you guys this presentation as well to look back on. But once you know Anki, like, you're just on a roll. Like I think Josh said, once he started using the pre-made decks and sort of getting them together, he just felt like a beast. So yeah, guys will get there. That's it from me.
Right.
I stop sharing now and stop bothering you.
Well, thank you, Daniel. This entire event was actually just a secret way for me to get you to present, but I think we'll move along. Tiffany Tan is up next. Hello.
Hello. Hi, everyone. Okay.
If you'd like to share your screen, and go for it.
I will share my presentation that I made totally not in the past couple of hours. Okay. Hey guys. So I'm in third year right now, and essentially with my sort of talk, I'll just be talking about summaries and spaced repetitions. The way that I study is primarily with handwriting a lot of my notes. I didn't tend to do a lot of digital stuff. So I'll sort of break it down in terms of lectures, PBL, and then some other stuff on the side as well. So with lectures, as you know, you sort of get a bunch of stuff. What do you guys summarize? So what I tend to do was do single handwritten page summaries. This was in first sem of first year. Essentially, it just helped me decide what was relevant, what wouldn't be as relevant or as high yield. And then during that time, because you're trying to condense everything into a page, you can sort of think of, okay, what are some quick and easy ways to remember things like this? So for example, if you have stuff like pancreatitis. There's like that mnemonic get smashed for the causes. So you can just like chuck that down rather than making a big ass list. So just things like that. But in second sem, I switched it up a bit and then I chucked everything into sort of just single notebooks, depending on whether it was gastro, cardio, or resp. Because that way I sort of had my lectures and the relevant PBLs alongside each other in the same book. So with that, you can kind of see in like the bottom picture there, I just sort of did headings based on whatever the slides were, or even going back to roadmap. I found that quite useful in terms of what might be relevant and what might not be relevant. So that might be something that you guys want to use. So essentially that's just how I split it up. Unfortunately, it is difficult. I can't like to go back and identify what information you've actually written down in the past. I can't say I've actually referred back to my notes in the past 2 years. Google's probably been more handy. So if you guys want to resort to OneNote, because that's what I eventually did in second year, it's definitely easier to find what you need. However, you do tend to fall into the trap of copying and pasting stuff. But if you have stuff like your iPad or Surface Pro with like a pen, you can import your PowerPoint as a PDF file and just annotate alongside it for key points or things that the lecturers tend to bring up. So that might be something that you guys find helpful, might not be, but might be something you want to give a try. So in terms of other things for lectures.
Oh yeah, sure.
Oh, sorry.
No.
Okay. Kevin, I think you've unmuted. Okay, great.
Sorry, guys.
That's okay. So things like I did in second year, so stuff like all the drugs from cancer chemotherapy, so that was like an onco lecture, just try to summarize as best as I could. And I also had to refer to lots of other like resources, just like Googling stuff, because lecturers don't tend to put the mechanism of things all the time, which is really annoying. So that's why I really like handwriting stuff as well, because I take the time to actually go through different resources and just really consolidate what is needed and what isn't. Histopath, which I regret not learning more because it ended up being quite high yield for second sem of second year. But yeah, just trying to draw diagrams to make it seem like it's not just a bunch of random spots and just make it something a bit more useful. You guys can do that. And then just drawing lots of diagrams and stuff as well based on lectures really helps. Okay, so in terms of PBL, once again, in first sem, first year, I try to do all these single page summaries. So they were just based on the learning objectives that we went through with the tutor. Once again, sometimes they don't tell you what the actual learning objectives are by the end of the PBL, Good or School of Medicine. So go to the roadmap for all of the actual stuff. Sorry if I am cutting out. Okay. And then on the back of the page, I just tend to write the mechanism. So it's easier to refer back to it. So you can refer to Kevin's chat for all of the mechanism stuff. Whoops. And then in second sem, what I decided to do was just to chuck it alongside the same notebook with lectures. So essentially the whole process of handwriting stuff out is just to get whatever you've typed out, whatever you've copied and pasted from like 50 different textbooks and 50 different like super notes and all those resources, just reconsolidating them and really writing them down into points where if you get a question in an exam, you can be like, oh wait, it's this. And then you can use knowledge from whatever bunch of lectures to actually create a cohesive answer. So that was sort of my thought process when I was approaching these sort of study methods. And with all of these notes, I wrote them all after the PBL session. So like whether it's mechanisms or just the short summaries. And by after, I mean not immediately after, like close to exams after. So I kind of utilize this as a way to like cramming in a sense without the cramming. Yeah, just a way I suppose to just refresh my mind. So that's pretty much that. And then with things like OSCEs, I know for I think first year's OSCEs have gotten cancelled. I don't know about second year. But things that you can do with flashcards. So because your tutorials are sort of set out in different types of presenting symptoms, you can just sort of whack on whatever symptom you want to like write some random questions about on the back, just so you can just go through that whilst you're like quarantining before you head in for your OSCEs. I suppose it's just something really handy to carry around. The resource I use most is mainly Tally O'Connor, but then again, it can be in a lot of depth and you need to know sometimes. I recently they have like the smaller handbook as well, which is more portable, like on the go rather than a thick chunky thing. That's really good as well. It was a bit pricey, but maybe you can find like a secondhand version. And then for anatomy as well, flashcards are really good. Or you can sort of tabulize things if that makes things easier for you. Yeah, and then sort of other different ways to reinforce info. Once again, with all of these notes, you shouldn't really be writing it down, setting it aside and forgetting about it. Definitely try to look back upon it as many times as you can. So great ways to do this are teaching to your friends, teach to different people, like whether it's in your PBL group, ICM group, whatever like sort of rotations you're in. I find that that's really helpful. And then they might have different ways to approach sort of whatever pathology you're looking at, or they might have other different like random facts that you didn't know about. Another thing that I heard some other people do is that they actually create like a separate group chat, and then if like because they're in different groups, and then if they're studying something or their ICM tutor tells them something that's, oh, this might be helpful, you can just message your friends, and when you're on the go, it's just a good way to sort of keep your mind going of random fun facts that may or may not be high yield. Using past papers was something that I like to do in terms of, if I was doing like MCQs, for example, and there was something that I didn't know, I'd write it down on a sheet of paper and just collate it into random pieces of A4 papers. And then before I headed in for exams, I just revised these things in case it popped up. Once again, it can be low yield, but like you never know sometimes. It's better to be safe than sorry, I guess. And also with past papers, when you answer questions, you can sort of make them into dot points as well, and use those as study notes, supported by whatever you learn in PBLs and what you learn in lectures. And then podcasts. Podcast has been something that I've been getting into a lot recently to reinforce whatever I've been learning. So Humorous Hacks is one of my favorite ones. They're really good. Highly recommend if you haven't started listening to them already. I used to listen to Med Geeks last year. Some of this stuff is a bit too out of the scope when I was in second year. So I don't know. And then it wasn't really as fun as Humorous Hacks. And then a new one I've discovered is You're Kidding Right, which is also by a few Aussie doctors. So that's also something you might want to look into. So Humorous Hacks and You're Kidding Right are Aussie doctors, junior doctors. Med Geeks, I think, is American. So don't know if that plays into a factor. Oh, I'm not done yet. And YouTube vids as well. So we all know The Godsend, Armando, Osmosis, Khan Academy, MedCram, whatever you like to use. They're really great ways to just revise like the PBL you've done that week, just reconsolidate all the knowledge that you've learnt. So yeah, and I can't really stress enough the importance of study groups. I think that's one of my biggest regrets, not really deciding to actually study with people. I think I just thought if I could just sit in my room and revise all of my notes and do past papers and all, it would be a great help. But you actually learn a lot. And remember things are much easier if you're teaching others. So that's something that I only started doing actually this year a lot more. So I would highly recommend if you haven't done so already. So that's all, short and sweet. Do you guys have questions for me? You guys can always message me if you have anything else. But yeah, if not, I will hand that over to Shaf. Thank you.
Thank you for your presentation too. If anyone does have any questions, you can just message me or Tiff afterwards and we'll be happy to help. So my presentation is a real ghetto one, and it's kind of like the forbidden fruit that like I don't recommend. It's more so if you're desperate, because it's like not the day before the exam, but it's like almost the end of term and you don't really know what to do and you're kind of screwed. For in like almost every situation, I recommend doing the stuff that Tiffany, Kevin, and Daniel have like told you guys about today, because that's how you'll actually learn. This is more just if you're desperate and really need to just pass. So feel free to ask questions in between, but I think this will be pretty fast. So yeah, cramming. Ooh. Yeah, so one way to break up, this is kind of what I arrived to at the end of second year, when it was like, I don't know, maybe 3 weeks out, and I literally hadn't touched a lecture for the entire semester and most of the year, in fact. So in terms of breaking up your study content, for you guys, OSCEs, I don't think is really a factor, because first year it's basically nothing. Second year, I'm not sure. I think it's also basically nothing. For anatomy, I found flashcards and using Rowan's photographic atlas was great. For PBL, mechanisms was always a really good way to do it. And for lectures, summarizing and answering questions was always great. This, I'll pretty much be focusing on how I summarized and went through lectures and a bit on PBLs. But essentially I broke down every lecture into 3 types. And this wasn't an active process, it just naturally comes about. You have the fluff lectures given by, like, say, Amanda Walker. Like, she's a great lecturer, but her stuff isn't really examined very often unless it spikes. That stuff, even though it goes on for an hour, you can cover in probably 10 to 20 minutes. There's the lighter content lectures, or stuff that's less likely to be examined, that you should learn to kind of skip past. Not because they're not important, just because this cramming, you cram to pass the exam by like 50% or 51% if you're lucky. You're not cramming to learn content. And of course, there's a ton of heavy lectures, which I would say only spend 70 minutes at most. I'm not saying that you'll be able to get through the entire lecture in 70 minutes, but if you're spending more than 70 minutes on a single topic, you're kind of wasting time. And if you're cramming, you probably don't have much time. So try and minimize how much time you do spend and maximize what you're learning in that time that you do spend. So if we look at a week of lectures, I'm not sure what week you guys are on, but I described week 6. You can break it down into conversations with the dying. There's maybe 5 minutes worth of examinable stuff in there. Heart and Pericardium by John Morley. Like, yeah, anatomy is important, but the lectures usually aren't very helpful, and you're better off just doing flashcards for them. These actual content lectures by Stuart Head, they tend to have a bit more content that you actually need to think about and understand. So I've colored them in yellow, and yes, so on and so on for the rest of the week. I wouldn't ever really actively color in my week of lectures, but if I'm taking a quick glance, I'll look at week 6 and be like, okay, week 6 is going to take me a day and a half to get through, because it has 4 like semi-heavy lectures. But I think this is actually a good week, because there's like 3 of these fluff lectures. Radiology, they're like 100 slides long, but they're never tested. So I don't think I ever even touched radiology lectures. But I want to kind of spend a bit more time on how to actually comb through a lecture and go through what's useful and what's not. Generally, you have a bit of useful stuff, a bit of supplemental info that you don't really need to know, but it's more to help you understand. You tend to get a fair bit of repeated content that's something that you already know from previous lectures, so you don't really need to go through it in depth in this lecture. And you also have a lot of useless crap that's kind of just the lecturers adding it in for funsies. With the repeated content aspect specifically, the lecturers tend to do that because there isn't always as much coordination between each lecturer as you might hope, largely because a lot of the lecturers are clinicians and they don't always have time to talk to each other about the specifics of what's going into each lecture. But if we break down this lecture given by Anne-Marie, hypertension and organ damage. Hypertension, usually something that gets tested a decent amount, and it's Prof. Hennessy's lecture, so you would hope they tested a decent amount. But you have stuff like this that's useful content, and you can tell it's useful because I don't have it with me, but if you check on the learning objectives, it specifically says know about the stages of blood pressure and hypertension. So this slide is useful, but the useful part is seeing that it's that at 140 milligrams of mercury, it starts affecting your kidneys. This stuff about tested across Australia for 7.5% of the population, that part's useless, and you don't, I would hope to not add that into your notes, because one, that's not really useful information, but two, they're never going to test that. The part that they are going to test is at stage 1, the cutoff is 140, and it starts killing your kidneys at that level. Then you have slides like this, supplemental info. It's not useless to know about the layers of an artery or whatever, but they're probably not going to examine this slide specifically. So it's good to know this, but if you're making notes for this lecture specifically, I would skip over this slide as something that isn't important for this lecture specifically, because chances are it's also something that's been repeated and in another lecture that you'll go into later. There's a lot of repeated content. So knowing about left ventricular hypertrophy in relation to hypertension is important, except there's I'm pretty sure entire other lectures about hypertrophy and heart pathology. So while this is fun and good to know, it's not something that's relevant to summarizing this lecture specifically. And then you have useless stuff, I'm not even going to bother going into this, but this is never going to be tested. It's more just a talking point that the lecturer might use, and you shouldn't even spend a second looking at the slide. So I kind of want to go through a lecture quickly to just comb through how I would go about it. So can you guys see this? Psychology of Health 1 by Jeanette Peretz or whatever? Or is it?
Say it for a second and then it went.
Hang on. Let me change the screen. Stop share. Start share. Share. Can you see it now?
Yeah, we're good.
Cool. Okay, so this isn't a long lecture. It's only 17 slides, but how I would go through it is, okay, first slide, useless. Psychology, this isn't about psychology, it's about health. This is kind of useless. This is kind of useless. Psychological determinants, sure, it looks kind of useful, but they'll probably not test this specifically. This is more words, that's useless. Some stuff about history. Now we start getting into the useful stuff. This is what they'll actually test. So this is the one slide of the lecture that I actually need to know. This stuff, less likely to test. This is more in the PPD category, and PPD stuff they almost never test, but if they do, it would be this slide. And then everything else, like the biopsychosocial model of health is great, except you don't really need to know much about it aside from it recognizes that there's interplay between the 4 factors. And you don't really need to know about this stuff. So that's this lecture. The only useful slide out of it was this, which you can learn. And I think they asked what's the difference between illness and sickness. But yeah, that's like how I would go through a fluff lecture. If we're looking at something that's a bit more content heavy, for second years, I have antibiotics 1, and I'll just have, can you see my notes and the lecture slides? Cool. So this is a bit more of a heavy lecture where you actually have a lot of content that you need to go through. And as fun as Gerald is to listen to, the way he structures his lecture slides is kind of all over the place. So what I would do is quickly run through it and be like, okay, these are all the stuff he's going to go through. Then go back to the learning objectives, write out my learning objectives, and then underneath every time he would like say something about antibiotics. So he's talking about bactericidal versus bacteriostatic over here. I would put it under, I would just create, what would I put it under? I'd probably put it under Introduction to Bacterial Metabolism. And if I come across a piece of information that doesn't directly relate to the learning objectives, it's not important information for me to consider, so I would just skip past it. Just want to reiterate that this isn't a great way to learn. It's just to pass if you're struggling right at the end. You guys are in a position right now where there's still like, I think 6-7 weeks after the semester. So cramming isn't really something you should even be considering right now. You should be trying to properly learn and summarize. But I know in a few weeks, a lot of you will have still not done anything. In which case, this is how I would cram. So just to show what that looks like, I've broken it. It's like, so this is kind of what my notes look like. I break it down into, these are what antibiotics are. Bold the important words, underline the other words. The notes themselves aren't very important. It's more the process of making them. And this is more just a streamlined way of running through notes. And I won't bother going through all that stuff now. But and after I summarize, and I'll go into the whole summarizing thing in a bit more detail, I would try and answer the learning objectives. So these are basically practice questions. After you go through a lecture, you won't really fully understand it until you try and answer the learning objectives, because then you're actually forced to recall that information. So how I would actually study, I would have the video / lecture slides on one side, someone else's notes like super notes in one corner, and then my notes in another corner. This way, if as I'm running through the lecture, if I run through something that doesn't make sense or the lecturer hasn't really clarified, I can look at someone else's notes and try and better understand that. And then I write it into my own notes so that it makes sense for me and is done in a way that I can better understand. And I would try and get through, my goal was always to get through at least 10 lectures a day. I think I only hit up to like 9 lectures, but that was because I was pressed for time. I'm not sure how much of that made sense in terms of how you'd cram. But does anyone have any questions? I can't actually see the chat, so.
There's no questions. It's just me
Cool.
saying it's really nice to have a reassuring approach, because I was getting mad imposter syndrome listening to all the other guys with their perfectly organized timetables and regiments, and it was getting quite stressful.
Oh, look.
So look, I know this isn't the ideal, but it's good to know that there's a fallback when everything else fails.
There is. Like you won't get HD marks using this type of studying,
I would agree.
with the other guys who are speaking, they are pretty much like the smartest people in their grades, and that's kind of why I had them come along to this.
For all the first years out there, that's not the common student.
Oh no, yeah,
That's not how we work.
They're exceptions.
Yeah.
But yeah, in terms of cramming, what do you think about pass and cramming? What do you mean about pass and cramming?
Separately or together?
Someone just messaged me. Never mind. So for cramming, the only other takeaway message I would say is it only works if you don't procrastinate and you are able to somehow focus on something for about 10 to 14 hours per day. The thing is, like, I was in a position where if I didn't, I would fail, like, without a doubt. And I imagine that's going to be the situation with a lot of you. So for the time being, I would say, know that it is possible to exist, but like, don't rely on it. Just try and do the other stuff. Studying, getting info for PBL learning objectives throughout the week. Getting info for PBL learning objectives. I would pretty much just use super notes because that's like tried and tested, but then also just quickly Google stuff and look it up on BMJ Best Practice, Amboss, or I think Medscape. As for when I would cram before an exam, I think as soon as StuVac hits, I started realizing I was screwed. So started cramming from then on, if that's any measure. It all depends on how fast you're able to go through lectures. By the numbers I showed up there, I'd be able to get through a lecture in like 30 minutes to an hour, but that was at the end of second year after I had like learned, they're not going to test such and such, so there's no point going through it. But like at the end of first year, it still took me like 3-4 hours for a lecture, which is sad, but yeah. Any other questions?
How are the first years going? You guys all coping?
I hope so.
I hope you're all coping.
I'm not sure how many first years there are here. It's a lot of content.
Yeah, it is.
Just know you don't have to study absolutely everything. It is a lot to get through.
One of the best things I did, if we're talking about tips, was I splurged and bought an osmosis membership for the year. Before I discovered you could just keep generating emails and keep getting free trial. And that was amazing for PBL, like neck level for PBL, because it just really condenses it down. So what cut off and I listen to a lecture, listen to an osmosis video, do my PBL based on super notes, and I've kind of got a full picture. It helps with the content because it's really hard to know based on a Mars lecture what's important.
Yeah, look, everyone has their own ways of studying, and I'd encourage you to not one-to-one copy what anyone here has said today, because it's probably not going to work for you. Just try and incorporate it into what works for you, mix it up, change it around until you find one that you've arrived at. But the key to that is actually try. I know it's hard, but just start studying now and you'll be fine. It's not too late.
And don't get too behind in your lectures. Try it, because you'll find, particularly with PBL, that for the majority it starts to get a little bit sketchy in year 2, but in PBL there's always a lecture on the topic that you are doing in PBL that week, and that includes the content that they want you to study. So even if you have to skip ahead a bit, which is possible now, skip ahead and look at that particular lecture, whether it's diabetes or whatever, because they include what they want you to know.
Yeah, 100%. Thank you for everyone who came. I'll be posting up the recording plus other resources afterwards. Yeah, I'm gonna head off to dinner now, but
Thank you.
good night. Bye.
Thank you.
Thanks so much for organising.